didn't know it. I thought it was like pain manage or physician. I don't know.
I don't even know.
Management and yeah,
So it's still getting there.
all right. Do you have anything to
John
do after
Hancock.
this?
Nope.
Like a hard stop time?
No.
So-
So how long does this typically?
Usually we try to get half an hour, but we get so excited about that
Yeah.
that we always go longer.
We
So,
actually do love doing our
it's your life.
our podcast.
It looks so
Good luck.
dramatic. Who let me on the podcast?
Me.
So
Forced you?
Who forced me on the podcast?
Okay.
Okay, go ahead.
Hi, guys. Thanks for joining. This is Essence of Medicine. Today, we're going to be talking about conservative management and spine physical therapy. My name is Amanda Armagast.
My name is Alyssa Haber.
And I'm Dr. Abbas. It's my true pleasure to have an expert here today with us, somebody who is going to make you understand what the conservative therapy is from a non-surgical side. And as we say, surgery is always last on the list, but my favorite physical therapist is here. Why don't you introduce yourself?
Well, that's very generous. My name is Jeff Winter. I don't know where to look.
Yeah,
Like camera?
camera is right there.
My name is Jeff Winter. I'm a physical therapist with orthology. I guess now we're Optum, formerly orthology. I've been in practice for, this is my 20th year. I'm entering 21 years now, and all outpatient orthopedics. And I had the great privilege of working with Dr. Abbasi for the last several years, and I'm proud to be here.
Well, you're not just a physical therapist.
Yeah, I was going to say, you're not just a physical therapist.
You are the physical
well,
therapist.
A doctor of physical therapy.
well, I'm a physical therapist, and yes.
And an
that's-
athlete.
I am I like endurance sports. Yes,
Triathlons.
triathlon is my hobby.
Ironman. Yeah.
Yeah,
Yeah.
So you live what you teach.
I try to. Yeah,
Yeah.
movement is important to me, and moving well is a critical part of that. And I like to teach
What-
people to do that.
What does it take to be a doctor of physical therapy? Run us through that, because most of us, we
Yeah.
don't even know what that means.
Well, it's just the degree they're giving for physical therapy at this point. Physical therapy used to be a bachelor's degree, and that morphed into a master's degree. And that's actually what I went to school for. I got a master's of physical therapy degree. And then 2 years after that, they switched the requirements, and we're expecting all practitioners by the year 2020 to be at a doctoral level, clinical doctoral level. So I went back for a couple more years. So it took me a little longer than most.
How many years?
3 full years after undergrad.
So, and from the high school until you were at your final degree,
Yeah.
how many years did you go to school and training?
Well, it takes 7. It took me 9 because of the extra. I got a master's degree and then a doctoral degree, so it took me a little longer.
9 years, casually 9 years. It just says that so casually.
Well, but I was a little. It takes most people 7. Yeah.
7, even 7 years, I'm going to tell you something I tell many of my patients. They come to me and I say, you need to go to physical therapy. And they fight me on that. They say, but doctor, I'm physically active. Doctor, I work in a farm and so on. Doctor, I go to gym. And one of the first things I say to them, I'm going to be correcting myself, is, listen, if that was you just watching some pictures or being physically active or going to a personal trainer, those people wouldn't need to go 4 years to school to be physical therapists. Now I'm going to correct myself. I'm going to say those people didn't need to go 7 years to school to be a physical therapist.
Yeah, because it's
This
not
is the
just moving.
misconception.
Yeah, it's not just exercising or moving, it's how you're doing it too.
Yeah.
Right. We get good at what we do, even if it's not well done. And the trouble is, most people tend to be very good at moving fairly poorly. And over
Yeah.
time, those adaptations will
I love
fail.
that.
And then you adapt a little bit more, and then those fail. And then all of a sudden, the body says, I have no more adaptations of movement. And that's typically when symptoms start, well beyond when the movement dysfunctions have occurred.
So we start, obviously, this is another thing I tell to many of my patients. We start when we are born, we just go, hoo, and we make some noises. We don't have really any musculoskeletal function. So practically, we can say by the time we are born, our function is practically functionality 0. We cannot even sit.
Mm.
when we are dead, hopefully when we are 100 years old and all of us will be dead somewhere, our functionality is as well zero at that point. Now, between that, we have a peak at different functionality of the spine. So, Jeff, tell me about, first of all, when do you think we as a human have the most of the functionality, and what can we do to make it start of a bigger stack of functional capacity? Because that is what you do, right? You restore the functional capacity of the patient.
Yeah, I hope so. I hope that's a large part of what we do. The spine, yeah, that's an interesting history to think about. When we're born, we don't have much functionality to the spine. Within the first couple of months, our head starts to lift and we start to gain a cervical curvature. Within a few more months, we start to stand and toddle around, and our lumbar spine gains a secondary curvature. And so we start to build that musculature very quickly. Really, I don't know how to answer the question to say, this happens throughout our life, though. We adapt and we're constantly becoming and molding and changing. We're very bioplastic.
When are we at our peak, though? What do you think?
Oh, sarcolema is it, or what's there's a term I forget now.
Say it with confidence, we'll believe
Yeah,
you.
well, no, someone's gonna look it up.
No, that's
There's a part where our bodies start to deteriorate functionally. It's probably around 30. Our late 20s, early 30s is when our functional capacity starts to deteriorate. So sorry to say that.
no. That is part of life, though. People who live like that people who live like they're always in their 20s and 30s. They're my patient.
Yeah, the weekend warriors. Well,
but I'm looking at that as two different aspects, or muscular, cartilage, and so on. They have their own development, and our nervous system, which controls them, has a different timeline.
Sure.
And they don't mature at the same time.
No, the musculature develops much quicker than the nervous system.
Here you are.
So the
So-
frontal cortex and so forth, probably not to your mid 20s.
Yeah.
Musculature in your late teens.
That is why you see the Olympic gymnasts
Mm.
in their 14, 15, 16, and the football players.
They retire at 20, right?
Yeah, and the football players, though, you see them in their early 20s.
Yeah.
Because you need the muscular, but as well you need the coordination.
Mm.
But I am in my 50s. I hate to say that. You're very generous to say that the decline starts at 30.
Yeah.
So I think that decline, I mean, how many football players do you see in their 30s?
Not many.
Not many.
It takes
Very few.
quite a bit. Yeah, I think it's a little like saying probably a lot of people can throw a baseball 100 miles an hour once. But it's the athletes we celebrate that can do it over and over and over, and season after season.
Yeah.
But they're by far the anomalies.
Let's go in the first stage of life, like before the children are at their peak of cartilage and musculoskeletal, before 12. Based on your knowledge, this is about not only what to do for the spine, but how to prevent that. I think that is should be a preventive talk about that in that time frame. What do you think? What should your children, my children, do to build up that capacity to the highest level?
Yeah, that's really tricky. Preventative medicine, I have found to be really difficult to sell. And I don't mean that to be a sales job, but it's hard to convince people that are feeling good to move differently. A lot of my practice in the past was working with soccer teams. We go to youth soccer teams, U12, U16, boys, girls soccer teams. And one of the things we liked to prevent was we thought we had a program developed to limit ACL injury or compromise. And
ACL,
pretty excited
for people who don't know that, just for people who don't know, ACL is
It's a ligament,
Anterior
anterior
cruciate.
cruciate ligament in your knee.
okay.
So I know this isn't spine related, but so
No, that's good. We want to know all.
the people who were really motivated to hear that talk were the coaches. They wanted to field the team. Parents were paying and driving their kids to the practices and games. But when we got there, the people who couldn't care less were the 12-year-old, boys and girls who felt fast. They were bulletproof. It's a hard
Also,
so I think, movement is a really important thing and activity is a really important thing. I think the biggest part is not at that age, overuse. And I think, this is not going to be very popular, but parents are one of the worst, are kind of the biggest opponent to that idea.
Yeah.
The fact that, I think it's Norway has a obviously different government system, but a government mandated youth sport initiative where they will not allow athletes to practice, play, compete for more hours per week than they are years in age.
I
And
love
we-
your mentioning that.
And we have blown that here. We
Yes.
just we overuse and get injured. Very quickly.
Brother plays football. He's a teenager. And in the summer, in the middle of August, he has 2 football practices a day. So just in that one day, it's like hours and hours of 6 hours of
least.
football.
And then if they're 2 or 3 sport athletes, they might go
And
from
yes.
football to something else.
Mhm.
And that's really challenging. on our
That
bodies.
is extremely important, especially in the developing age,
Yeah.
because that is where you put the fundamental of your health.
Hmm.
And you start with bad cartilage because you were pushing against people that are twice your weight in a football.
Mm.
You're starting at the much lower capacity than you think. It's about the balance. Yes, maybe if you push them hard, they build up muscle,
Yeah.
but then they destroy the cartilage. And the balance is, I think, more important than just being able to be just fast or just being able to curl more and so on.
Somebody said once that children are not miniature adults.
Yeah.
Their structure is not the same. We cannot treat them the same.
And I noticed that in many of these sports, they built what is really specific to that sport. But whereas for children, you want to have a balance, the overall health, that you want them upper extremity being as strong as lower extremity and the core muscle to be strong. You want them to be fast, but did you know that the mouse is faster than the fastest human? What does that tell you? Our body is not built to be fast. It's endurance is important for us. Like
Right.
walking, you tell me about the economy. What is the economy of our body? You know better than anybody else that what is the human body is best at compared to animal body?
Oh boy, I don't know that I'm going to find the answer you're looking
Yes,
for.
you do because you do it yourself. Endurance.
Yeah,
Walking
and
is-
we're good at finding capacities with low load, long duration, high frequency, that kind of.
That is exactly what we are the best at. We can walk. There are studies out there. We can walk a deer to death. We walk, deer sprints, and then we can exhaust that. That was actually a way of for us hunting long time ago. A walk mile by mile. Humans are the best in walking than any animal in the whole planet. But try to run. That is where to overuse your body. You try to compete on things that are not natural to our body. That is why I think I admire you that you are doing this endurance kind of sport.
Oh.
And the things that truly, obviously, you are yourself a sporty person and you're pushing it. And your limitation, you are opening up new ways of, tell me a little about the sport that you do. What do you do and you do it for fun?
Well, I do it for fun. I'm not very good at it, so don't celebrate this.
But that's the point.
Yeah.
Try to be really good at it in the apostrophes is where you destroy your
Yeah.
body.
Well, and that's why I love the endurance sports because I'm really only competing against myself.
Yeah.
And so triathlon is the sport that I love, which is swimming, biking, and running, and in one event. And there's varying lengths of distances that you can do that for. But I really love the idea of finding my edges, my capacity at a certain movement or duration, and seeing a lot of it's a lot of it's mental, a lot of it's physical, a lot of it's emotional, and trying to find that balance. So the biopsychosocial is kind of how I like to treat patients, and I like to tap into that myself as well.
Now, one of the things now that we are talking about the children, how we can optimize their capacity. I mean, we are obviously these 2 young women are in their 20s. What is you mentioned about that limiting the hours. Do you have any other recommendation for parents that for them, the glory is not as important as the truly health of their children? What what, as an expert, what would your recommendation otherwise would you give to parent of the children up to 10, 10 to 20, 20 to 30? I think
Yeah.
you guys would be interested in that.
I'm interested in this right now as I was like a 6-sport athlete and I have plans that my children will probably go down that road.
Mhm.
And it almost breaks my heart a little bit, even hearing you say, not having sports, before the age of 10. I was doing sports way before the age of 10, and I don't know what I would be or who I would be without them. So I really am interested in hearing, the more medical side of things, because that's just engraved in my head.
Well, and to add to that, Alyssa, not doing sports before the age of 10 will actually impact your athletic ability a lot, because I remember in hockey, you had to have been playing hockey like since preschool.
Mhm.
Otherwise, you weren't going to get on a good team, and whatever team you're on is going to be, probably losing a lot because the other girls have been playing since preschool too.
You nailed
So
it.
it's really interesting
100%.
how much would change if you're not doing sports.
It's not even what you had said. It's the other stuff. It's the camps, the traveling teams. It's the extra work they put in at night and in the morning. It's not even the sport itself. It's to the degree that we have put athletics on a competition level.
Yeah.
You have to win. You have to be the best. You have to be in the best shape. And how do you do that? By putting in those hours.
What I hate to say, we have made the sport to a religion here.
We have. No,
And
I
that
totally
is-
agree with that.
And that is like, nothing else really matters. But I want to know from the expert.
Yeah.
I want to know, I mean, my grandchildren, I hope I don't have them for the next 20 years, but
Well, your
coming
son's
back-
getting married this
oh,
summer.
no, don't mention that. So up to 10, don't limit the hours and the exposure. I mean, the severity of that. You give us, like 3 best thing you would do for your own children, 0 to 10, 10 to 20, 20 to 30. Enlighten us.
Well, this is a really tricky conversation.
Yeah, it is.
Because there's a lot of political involvement
Yeah.
and there's a lot of people making decisions. But what I find is interesting is the people who aren't making the decisions are the athletes.
Yeah.
Yeah.
And they're the ones who really just want to go have fun. I'm probably the last of the generations who remembers a significant amount of my childhood at the park. Playing pickup games and running and playing football,
Catch.
basketball with my friends at the park. It was unorganized though. Now you never see kids at the park because it's all organized.
Mhm.
And so when I was growing up in the 70s, 80s, 90s, it was more about one sport lasted a season. Now the sports are all year. And so now I can play soccer all year long. I can play baseball all year long. I can skate and play hockey all year long. And when you're done with this, then you go to the next thing. But then it's not just that one sport, it's the next things. And so, and I think that there is overwhelming evidence to suggest that until the age of 13, actually, your potential isn't limited. So 10 years old, I think that you're still fine. The trouble is we've created a system that's required these kids, like you said, if you don't catch, it's hard to catch up to your peers.
Yeah.
And that's really what the kids are missing then. If you take them out of these sports, is their camaraderie, their friendships. This is their livelihood and their life. They love this. And if you take them out of that, that's where it gets a little tricky. So, but again, I'll come back to Norway. They frequently win the most gold medals in the Winter Olympics. They're doing fine athletically.
Yeah.
So what are we missing? But there again, I don't want to get all political, but it's a huge money. The industry of youth sports is enormous in America.
You cannot get into the health without getting political because lots of
true.
money involved and
Yeah.
politics literally dictates where the
Right.
money is spent and earned and so on. But here, our job is, what is our goal in this podcast, Amanda? Education, public, things that have truly, we have made a pride of teaching people that they can involve in their daily living next day and benefit from that. So
Yeah.
I'm not afraid of stepping on any toes as long as
No.
we
Which is
teach.
great. No, I
Which
agree
is
with you.
so
So back to the question, I think for the young athletes,
Mhm.
exposure to all sorts of activities, not just with rackets or with sticks or with skates or with balls, but with all sorts of things, running, jumping, landing, get the whole body to move, have them do multiple things and see what interests them, see where their skills lead, see where their natural tendencies are. From there, I would suggest multiple like cross training. Only do that sport for have the off season be the off season. A rest from that sport doesn't mean a break from all activity. It just might mean from that particular movement pattern. So maybe introducing, if you're a baseball player, play some tennis in the off season. Football players should go swimming. We should do some things that encourage the rest of our bodies to be active and healthy and stable so that we can have the energy, the capacity, and just a better bodily function when we get back to the sport that we actually love. We can have an A sport, but have a B, C, and D sport too. Yeah.
Now, you said something about your childhood that you were last kind of generation that went to park and just did.
Maybe.
We didn't have parks. We did it
Yeah.
on the street.
Mm.
We went played how do you say, hide and seek, then catch, and you tag, and then with soccer. And as soon as it wasn't fun anymore, we quit.
Yeah.
No, do you know what it says? I have seen that the poor child is sleeping and the mother or father, wake up, we have to go to this and that and so on. And the poor child is just getting dragged from one event to other. I think the children, it's like food as well. If you give them a natural kind of environment, they have a good understanding. And we know that from studies. If you get a bunch of kids in a natural environment, you give them natural food. I'm not talking about Doritos. We have a natural way over thousands of years have fine-tuned to get what we really need. Same, I think, with the activity. If you give them the baby foxes, they play. The baby wolves, they play. If you give them a natural environment, we have the natural tendency of picking and choosing activities that is put us in the right path. Now you put a ball between them, and then lots of helicopter mothers and fathers there. Then
they're not going to learn how to throw the ball.
and then they learn things that are at the level that it's really unnatural for our body at times. Like how many times in life do we have to tackle somebody who's twice our weight and so on?
Amanda's tackled me a couple times and I have it on video.
Yeah, talk about it.
Okay, let's go now in 20s. Okay, so we covered and I love what you said. I mean, if you don't remember anything, remember that the balanced activity.
Yeah.
Okay, that is, I think, that really the goal. In your 20s. So what do you recommend to these two young women? What should they do to stay healthy longer?
Yeah.
And
The trouble in our 20s is that we sit down a lot more.
Yeah.
We've gone through school, we get a job, we start paying off loans and so forth. We become adults.
I've
And-
actually had that transition recently, and it's really a tough one.
Yeah. And then, for these six athlete, old athletes here that used to play six sports at a high level, they still feel like they've got it. They still feel like they can do it. So the challenge is not to jump into that activity or the first opportunity you get. I had a patient years ago who had some back pain, and he was in his 30s, a young guy. And I asked him if there's any provocative activities. What did the previous few days look like, or the previous couple of weeks? It's been coming on for a couple of weeks. Nothing changed. No, it just came out of the blue. So in the conversation, we were talking about, well, what do you love to do? And he goes, oh, my friend and I just found this great golf course. We golfed 36 holes like 2 weeks ago. And I said, wow, that's a lot of golf. I said, do you do that a lot? And he said, wow, I used to do that all the time. I said, well, how long has it been since you did that? He goes, well, probably 18 years. I said, well, why in the world would you think you'd be able to just do that again? Of course, these are repetitive, big activities. Just because you used to doesn't mean that you can anymore to that level. So giving yourself lots of grace and permission to not be the person you were, but still being active and trying to get back to those high levels.
You would be surprised how many of my patients, the first question they ask me is, when can I get back to golfing? Golfing.
Yeah.
Life is fun. Golf is serious.
Yeah.
So
Golf can be fun.
yeah, no, but for them,
Yeah.
it is serious. That is what they live
That's their goal.
for.
Their livelihood. Yeah.
Well, it's not necessarily livelihood, but it is that for them is a serious
They look
thing.
forward to.
Yeah. Now, but let's pick up with the, not again, come back to 20s.
I say you did a great job explaining what you used to do. You come out of college, and my backstory quickly is I played sports. I did the college athletics, and then I did this. And so I'm kind of at that age where I feel like if you threw me back on the court, I would give you nothing less than 100%.
Yeah.
I would wake up the next day not moving.
Yeah.
Oh,
maybe.
yeah.
And we hop back on the treadmill. We want to get healthy. And the next day I roll over and I go, I've never been in so much pain in my life. And I'm 25 and I'm not used to it.
And your body's doing exactly what it's supposed to be
Exact-
doing in that way by protecting you and saying, oh, that was a little too much.
Yeah.
Don't do that again.
And I love that because that's exactly what pain is. The Lord didn't give us pain to torture us. It is,
People die, without pain.
yeah, if you don't have pain, then there is a disease that you lose that. We just did a podcast about the pain, what it really is. There are some diseases that they don't have pain receptors. These kids, by the time they are 4 or 5 years old, they lose their fingers. They have a stump. By the time they are in their teenager, they have practically lost their feet, and because they don't learn from not doing things that are damaging to them.
Right. Pain as a response of the nervous system to the body is a wonderful protector and reminder of your limits.
Yeah, life is very short without pain. Let's just agree on that.
Yeah.
Now, so you get now toward toward your end of 20s, you're turning 30s, where you thought we are going down the hill, but you're going down the hill from someplace. Meaning that if you have already a couch potato in your 20s, you have much less capacity to start with. And what do you think, to give a good start to this decline that I guess is natural? What should they do now?
Like how to soften it.
How to not only start higher and soften the decline? What activity should they do? I mean, I'm beyond that. I don't need to listen here. I can just take off now. But what should they do now in the next 5 years?
Yeah. In their 30s?
No, well, right now,
Right now,
how should they prepare themselves?
You told me I have 5 years left to prepare for my decline.
Yeah.
Listen to planners.
I gotta get that potential up there. I actually just had a half birthday. I am at 4.5 years now.
Yeah, she's really type A. So
Wow.
get a list.
Get a list bulletin.
I would say find a rhythm, find a pattern, find habits that encourage healthy lifestyles. If we depend on our motivations ebb and flow and they fail us over time, but consistency is what gets you. So find something you love to do, find a rhythm in your life that allows for it, and just keep doing it. And it's not all about activity. It's about your mind and your balance and your breathing and your flexibility, your stability, your strength. Find something that brings you joy that you don't mind doing a few times a week, and find a pattern.
Amanda, did you notice he just described the life gym
Yeah,
concept
I've
that
been
you
wanting-
are?
yeah,
You want to go talk about the life gym?
Open that can of worms.
Didn't know.
Yeah, we have a concept called the Life Gym, which we're establishing in our wellness centers.
In the healing centers.
The idea behind it is that you find movement in your daily life or find ways to like gym in your daily life. So putting away the dishes and cleaning, gardening, hanging out with your friends, stuff like that. Like don't hang out with your friends sitting down drinking tea, have a walk and drink your tea.
I like that.
No, but the concept that, this is truly what I see. People get into their car, drive 3 miles to the gym, then get there, spend half an hour first admiring their body in the mirror. Then they go and make the biggest thing they can do. And if the cute girl is next, they do double. And then once they literally abuse their body to the extent, then they go they sit back in their car and drive the 2 miles back to their home, and then sit in the front of the computer and spend the rest of the night in the front of a computer. Whereas in our healing center, we want to change, as you said, consistency, habit, change your habits, make your life, make the exercises part of your natural life. Did you know that 40% of the people in Denmark, they bike to work. I actually more. Did you?
I TikToked about that.
Yes, you did that. But in most of Europe, a significant amount of people, they
Yeah.
bike to work.
Mhm.
Yeah, but our roads are not built for that. If I wanted to bike to work, I'd have to bike on like 494.
Yeah, we will get killed if you bike in US.
We're not
Our
set
roads
up-
are
we're
not
good
meant-
set up for
Sometimes
failure.
people that live and work in Manhattan walk, several miles every day. So
Mhm.
depending on which area of the country you live in, but certainly, yeah, no, you're absolutely right. We're very sedentary in
Yeah.
our culture.
No, so this idea of what you just discussed, and we call it life gym, is that create a habit in your 20s that you can keep on, and that they increase your functional capacity. And functional capacity is not a made-up word.
Hmm.
What is a functional capacity, Jeff? What do
Well,
you explain to our viewers what that is?
Well, I may not do it your justice, but it's a moving target, I think, is an important part of that
Yes.
word. It's not something that's static. It's not something that you have and that's what you have. It's something that you can keep pushing towards and finding what is my capacity on this day with this activity. So it's something to keep striving for, certainly. What are you looking for?
I'm looking, so when I send a patient to you and I say, do a functional capacity
Hmm.
test, do you do it in orthology,
Sure.
functional
Yeah,
capacity?
functional
It's a test,
capacity.
right?
Yeah, it's a
It's a
long test.
well-defined test.
Yeah.
Describe it to us. If I send my patient to you and say,
Yeah.
Jeff, this is my patient,
Yeah.
and I want you to do a functional capacity
Yeah,
test, what
it's
do you do?
It's a long exam. It could take hours to days. And it's in multiple positions, multiple lengths of time. People are crawling, people are laying on their backs doing things, people are standing, lifting heavy things, finding out what the capacity may be, but it's in
There you are.
multiple arenas.
Yeah,
Right?
well, you just beautifully described it. It's about how to perform as a human in the things that the human are supposed to perform. Do you ask them to take a ball and throw it at 100 miles an hour?
Once, no.
No, you don't. No, you let them crawl, you let them sit, you let them stand up, let them behave like a
Mm.
normal human is supposed to behave in a normal
Normal
life.
physiological stresses.
How much help do you need for that? Or can you do it alone?
Mm.
This is something that actually insurances pay us based on, how much do we restore it? Or if you lose it, if you sue somebody and they come and say that I lost so much. So this is actually well-defined. How much can we perform? As you as well beautifully said, it is age-related. So
Mm.
this is a moving target, but that is the beauty of it.
Mm.
If you try with your 60s, have a functional capacity of a 30 years old, you're just going to fail. But what in my business is important is about how can I make people independent
Mm.
in their life? And that is my goal in my surgery. And I hate to say that. I put these links, this presentation of cases on LinkedIn. Few very young, very inexperienced surgeon, they know who they are. They just jump and say, I want to do this and that and cut it this way, I could make that angle, this and that, and so on and so forth. But my goal is not glorifying what surgery can achieve. We can do crazy things with surgery. I can take one of your foot and implant it in your forehead.
Right
Make
here?
it work. Right there. I can make it and I can make it work. I can take your
You could do the
facial.
Wim
Grab an artery and a nerve, go up.
Yes,
I
I
know.
can make it functional for you, but is it really the goal of what we want to do? No, I want that person to be independent up to in their 90s. I want to make a 90-year-old nun, 94-year-old nun,
Mhm.
being able to do everything but flipping the mattress.
Mm.
Somebody who needed 4 people to take care of her during the day, being independent, making that person independent is actually my goal. Restoring their functional capacity to their age group.
Mm.
So and for me, their threshold is being independent.
Yeah, this is
much-
why we work so well together, I think.
Yeah.
We have a common heart for people.
Mhm.
These aren't just patients. My first mentors, Greg Santama and Rick Young, were my first bosses, and they were very clear to teach me very young in this profession. Always remember to see the person in the patient.
Mhm.
Who are they? What do they love? What do they want to get back to? What are their goals? Have them help you write their own
Define
story.
that. Yeah, define
And
that.
and just because you can fix something doesn't anatomically doesn't necessarily mean that it will help them. And working with great providers is just really a gift to be able to notice these people that are finding their capacity to return to participation in their lives with minimal invasion as possible.
And I think that letting the patient being a big part of that, meaning defining what their goals are and helping them as well to fine tune that. Like, this is an old story and I have told it maybe 1,000 times that 89-year-old person that I did a surgery a year ago coming to my clinic is being very angry with me that I didn't keep my promise and so on. And then we went through the individual steps. We have a way of dealing with that. Well, the back pain went from 9 to 3. The leg pain gone. Walking is good, but he cannot drive 300 miles to Sturgis on a bike as he used to do a few years ago. That was for him the goal that I could not make him able to do again. And that for him was failure. Who failed there? I failed
In education
to communicate with the patient what are realistic goals that we can achieve. And obviously the entire medicine failed to clarify, giving that person 5 different other goals in life, 5 different other hobbies in life that he can enjoy as much as not only alone, having his 84-year-old bride sitting back of his bike to go 300 miles. They tried it for 15, 20 miles. I'm happy if I can just drive my car in that age.
Yeah.
But but that is these goals as well. Part of our job is educating the people about
we need
those
to be great
goals.
clinicians, but also good educators and motivators and communicators.
Yeah.
Mhm.
That's a huge part of our process.
So let's go back to the core of this conservative therapy. The core of the conservative therapy is how you're going to keep the people away from me. How are you going to do that? How can you keep these two away from my
Far
my
away.
expertise? Far away.
Yeah, my
Even
office
though-
is actually on the other side of the building.
Yeah.
Second floor.
So that won't help you. Won't help you. No, and in our protocol, one of the first thing I do, except if they have instability, meaning there's a piece of bone moving the wrong way in a dangerous way, people who are scheduled to get a surgery here in this town, they come to me, I say, stop. You have to revisit few things, and I send them to you. What are the things that when I send them to you, what am I looking for, and how can you keep people who are already on the bad side of the slope?
Yeah.
How do you keep them away from me?
So people that are already suffering from pain have already failed all their adaptations. They've lost function, but we can't start with function. We need to start way back. We need to look at the tissues and even cellularly look at what do these tissues require? How do we get them back to a functional, good, healthy level? And then looking at mobility with those soft tissues, can they go through ranges of motion that are appropriate? If they can't do, once they can do that, then we start looking at the bony structures and say, what are the arthrokinematics? How do the bones move? Are they moving correctly? Are they achieving the shapes that they need to make? And then stability, getting the shoulder blades, the pelvis, the diaphragm, all these the supporting musculature, the synergists working well. And then we can work on function. So it's really a progression back to function, but it starts with even tissues and bones. And 2 words we use a lot in the clinic: kinematics, which would be let's say kinetics first. Kinetics are like the forces we overcome to move, right? Force, gravity, torque, friction, that kind of stuff. Kinematics speaks more to the shapes we make to overcome the kinetics. So how, form and ergonomics, how do we hold ourselves? What do we do 1,000 times? So how do we do that? So mechanically making sure that it's very pure is an important part of that process.
I wanted to make a point that I really like that you said about all the steps that come before having that function coming back. Based on some of my experiences, not just here with patients in general, when it comes to physical therapy, is most of the time they think that they're going to go in to gain their function back right away.
Mm.
And I think that you emphasized very important parts that you can't just gain that function back.
Yeah.
There is a lot of different levels that you have to repair, strengthen,
Right.
whatever it may be to get to that function.
Right.
That takes time.
The
And
function was the last thing to fall. And so
Exactly.
starting to get back into again, movement and what broke down and how do we kind of get that back? I think a lot of physical therapists, a lot of therapy clinics, just I see patients who are coming from the third, fourth therapist. I may be well down the line, and they're tired of seeing people. They're tired of telling their story. They're tired of another appointment and copay and PTO and no more paperwork and all the stuff. And they expect me just to give them 5 more exercises, and then I'll add 1 a week, and I'll see them next week. And it can't start there. If it was a weak and strong conversation, we wouldn't have met.
So, if it was easy, it would be done long before they meet you.
Well before, yeah.
Well before. Now, and you know, some of them, they say, you know, they gave me the few pictures and I'm doing those exercises at home.
Yeah.
And they come and tell me, you know, after 2 visits, they say it didn't work.
Yeah.
And that is, you know what my answer to them is, you know,
keep going.
if it was just printing some pictures and giving to people, then they wouldn't go to school for that long. I think the expectation that this is like a pill, like a medicine, like a flip of a switch, that you just do it and then all of a sudden they get better. That is the first thing that we on my side, when I send a patient to you or anybody who send a patient to you, that this is not, if you go in and come out and everything is better magically, you didn't really need them. And that is, I think that is what we have to work on our side, especially you, Alyssa. You will be on the clinical side, hopefully very soon, that we have to create that kind of expectation management about what are we trying to achieve, and that will take time. Now, the first visit, when I send a patient to you, so this patient has degenerative spine disease, facet disease, and so on. The first visit, run us through the first time you meet the patient. What are the major things that you do in the first visit, and second, and the third? But let's start with the first one.
Well, it starts with conversation, and the conversation continues throughout the whole process. Just learning their story, being invited into their process of what they've been through, how they're currently feeling, what makes it worse, trying to find what makes it better, trying to learn some of the patterns that they might reveal to us. And they're the expert in the room. I'm not there to show them what they're doing wrong necessarily, but just kind of hearing them talk about their own experiences often reveals a lot of what needs to happen in the treatment. And then taking evaluations of how do they move? What is not doing its job correctly within the body? Certainly there's a biomechanical kind of approach to this as well. Some of it's anatomical, but some of it's learning, they believe certain movements are dangerous or not possible. Why? Going further into that, what about that? So trying to figure out and then a big part of it's their goals. What do they want from me? How can I serve them? What is the purpose of, why did they come in today?
And many of my patients tell that to me, and I'm going to tell what I tell them, that we just talked about things and it was trivial and so on and so forth, that it wasn't, nothing was major and so on. But let me tell you, every time you fly and the airplane lands smoothly and everything is trivial, that is where the experts are in. If you come in and you're just wobbling around and then hit the ground and then, oh God, you survived, that pilot was not an expert. If it's smooth, if the ride is smooth, if it appears to you as a non-professional that nothing really happened, that is very, an expert was at work that make the thing, to make the flow, make the trend truly expert-like. Like when you come to my surgery and you think this is something very trivial, that I did my job because I made a very difficult process look like it's nothing there. But we noticed that, like in my case, those surgeons who come and truly understand how deep this is, what we are doing, they put more effort in it. There are some that the inexperienced people come to us and they think it's just nothing. You can just go out and do it. Experienced people understand how much it's in the background of make that conversation, of that flow, of that plan to be where it needs to go. So there is a reason that it takes somebody to have a doctorate degree to do that. Okay.
Well, it's just a lot of it's just believing them,
Mhm.
Yeah.
you know, and I think that sounds so simple, but most patients have a lot of pain and they might have gotten passed around. And, you know, pain is a funny thing to even talk about because it's ubiquitous. We all know what pain is. We've all been in pain, physical, emotional, mental. We know what that is, but we can never know anybody else's pain. So to sort of stop the conversation and say, this must be really hard. Sometimes they don't get that. Maybe you're the first person to acknowledge that their
Mhm.
pain. I mean, coming to a clinic is enormously inconvenient.
is.
So to come in is a hard thing. So that they're
Yeah.
there anyway really speaks to they need us to acknowledge that.
So Alyssa, listen to that. This is now, you know, that is what we say in medicine, that young, inexperienced, and poor doctors, general, they treat pictures and lab results.
Mhm.
Mm,
Good doctors and providers treat symptoms, but excellent surgeon and doctors and providers treat people.
Yeah.
Okay, and that is truly,
mm,
you know, the different in that seeing in there, and sometimes hard now for surgeon. I have to say, once you start the surgery, you have to, and that is the dichotomy for surgeon, specific surgeon. Once you start the surgery, you have to turn that part of the brain off. Then it is just a mechanical thing you're going to fix. You have to put your humanity behind you. Otherwise, you cannot put a knife and cut into them and so on and so forth. But generally, once you have to do all of that before you get to that point, that you're treating a person and no protocol can be made for that. Listening to them, listening their story and knowing what they are looking for, what their goal is in life. Their goal might be to get to that Hawaii trip next summer.
mm.
As long as it's reasonable, you have to enable them to achieve the goals they put in place, but don't be shy of, you know, helping them to get that place. If that goal getting to Hawaii means they will never walk again because they're neglecting a spinal cord tumor, you have to be as well involved in making them understand what if those goals are realistic and what is the consequences of those goals they put in place. But I think making that truly, that is why I don't believe ever artificial intelligence will replace you and I.
I was going to say that exact thing, that I don't
Yeah.
believe that computers will ever take over this for that emotional connection.
Because what we do is the humanity of what we do is what we do, and you can take those protocols and so on. You can't replace it.
Yeah.
Computers do much better with that, but
Yeah, it's much more of an art form.
yeah, it is.
I used to work with somebody who called patients customers, and
Yeah.
it rubbed me the wrong way, but I couldn't figure out why. And I find the language I finally put to it was a customer is always right. Patients aren't.
Yeah, that's a good
Yeah.
one.
A customer is a recipient of goods and services.
Yeah.
A patient is a participant.
Yeah.
Yeah, we need that patient to participate in their care. It's not a reception of our skill. It's a participation.
So we talked about, you know, many things, and you know, we are having maybe we don't want to go too long here, but I send the patient to you with a hope, truly genuine hope, that you and the patient come to a conclusion that he says, you know, I'm good now.
Yeah, me too.
Doesn't matter how bad the picture look like.
Yeah.
Okay.
Right.
So and you develop this plan for them. You create a platform for them to get to the goal that to strengthen their paraspinal muscle. Do you change their activity of daily living? You teach them how to do things in a better, more kinematic, efficient way for their spine.
Yeah.
How many visits do they need in average? I know every person is different.
Yeah.
How many visits does it take you to develop that plan? How many visits does it take you to implement that plan? And how many visits does it take to reevaluate and say it's working or it's not working?
That's a really good question, and I don't like I don't like that question because I don't think there's a number, and I don't want to pretend like before I've met this patient or worked with them that I have any idea what they're going to need.
Mhm.
But typically, it takes a visit or two. You had said You want them to kind of not know what we're doing. I tell patients, I want them to have high expectations. I have really high expectations. In the first visit or two, we should have a lot of information, lots of data collected to know, are we on the right track? Are we aiming at the right target?
So 2-3 visits before
We should
you
have a
get
lot
to
of
know each
information.
other.
Well, and we're starting to move. We're starting to see some changes. We might tweak a couple of things, but I'm expecting significant, meaningful change very quickly. Now, it's not going to fix it necessarily, but if we can see that we're hitting the right target, then we keep going. Maybe it's, I typically see patients once a week. I know a lot of places will see them 2 or 3 times a week. I don't know. That seems to be like they're trying to.
So you prefer once a week?
Yeah, once a week seems good because I'm giving them things to work on, things to be aware of.
Work.
Yeah, but it's not so much exercise. I'm kind of an anti-exercise therapist. Not that I don't like exercises, but I think that we PTs make a lot of stuff up. We hold 30 seconds, repeat 5 times, do it 4 times a day. We just made that up.
Yeah.
I want them to be
love that.
aware. I want them to be aware of how they're moving. How do they walk to the car? That matters to me, not as much, equally maybe as much as the things that we're aiming at specifically. So, and then from there, maybe, we start to evaluate and we set up a couple of visits and we see how things are moving. But ultimately, I tell people the hope is my job is to get rid of you, and maybe we'll become, once or twice a year friends. Where something goes wrong and you need to come back in for a little tune-up, we can work on some things as they come up because we want to get you active and healthy and participating. And healthy participants get hurt sometimes. And that can be normal.
Now, to be on the practical side, most of the time, the physical therapies are approved by insurances for 6 to 12 visits. I generally get them approved for 12 visits on the higher side because I realistically don't expect anything really change after just few visits. In your hand, what is the insurances usually approve the patient to come to you? How many times, in what time frame?
Yeah, I don't usually run into that number being a barrier. I don't see 12 visits on a referral as, oh, we're going to see you 12 times. I see that as, hey, we've got some time to work with you. We'll see if this is helpful or not. We'll see. We'll have a very good understanding of what we can do very quickly. If we need more, that's typically not a barrier to get more. If we can justify, and the documentation is very good to justify the need, but
that is why
it's not about trying to get more visits.
No, but
it's about what do they need. Yeah.
This is my conversation with my patient. Are you better now? Are you going the right? Not that you're free of symptoms. Are you better? If you think you are better in a good way, we should keep going that route. And you will see that the patients are truly, they understand that they're on your side. People who are convinced that there's only one way to fix them is cutting them open. Yeah. Once you send them there, they say, yeah, my daily activity is better. I say, if I think you're going the right direction, let's be patient. Let's go more in that route. Let's see what we can more achieve. But some patients, they come on back as well, tell me that, no, I'm not better. And then I get a letter from you. We have done what we can do. Yeah. Let's get in that direction. When is the right time on your side to see in a patient? Because many of them will be in that point. Nobody can fix everybody. But when is the right time, or how do you decide that, there is more needs to be done with that patient? Yeah. What are your criteria?
Well, and that's kind of the art form of it, right? There's not a protocol or a criteria necessarily, but it's more of looking at their symptoms. What are the symptoms worsening? Is their participation decreasing? Is their recovery time increasing? Is the distribution of the pain getting farther? Those kinds of things. If those are the cases, then we can tell pretty quickly whether they're not responding well to conservative care. Sometimes it's very obvious, 2, 3, 4 visits, we have a lot of information. Sometimes it takes a little bit more because it's a subtle change that, they're not maybe changing very quickly, but that might be normal. Let's keep an eye on it. But if there's a drastic change, if there's something significant, certainly we get on the phone right away.
And that is actually Kate probably talking about one of the patients, so we have to wrap it up a little faster here. But now many patients, they want to have an expectation, they want to have a timeline, and I try to dampen that all the time. But I generally tell the patient, don't expect any changes in the first 3 or 4 visits. within six visit, you should know, and I send it to people who are really working well with us, and they tell you if you need to come back to me.
Yeah.
So give them at least 6 visits. That is what I really, because as you said, many of these patients, they have been in pain for a long time. They want a quick fix.
Yeah.
Mhm.
But I tell them, after 12 visits, we definitely should sit down together
Oh,
and
yes.
make a decision together.
Yeah.
That decision not necessarily need to be final or, regarding one way or another, but that is a good time frame to make a decision together. What is next? Now, once I do the surgery, though, I let them know that we decide on the surgery. I tell them we are not done. I'm still going to send you back to learn all the things you need to know, and during the time of the surgery, like transitions, how to behave, what to do, what not to do. I think one of my good privileges is that in my surgery, I don't cut the muscle. I don't, as a matter of fact, when we cut the muscle and detach it from their origin, like in a regular surgery, those muscles are rendered useless. They're not muscle anymore. They're scarred. They're not much really useful to you. So let's say you built beautiful paraspinal muscle and I destroy them all right after the surgery. So that actually they recover longer because now they have more muscle to be in the spasm and so on.
Yeah.
But in my surgery, they're all pristine. So I do want them to build muscle functional. I want to raise any surgery is an injury, right?
Yeah.
We can agree. Any surgery, you drop your functional capacity drops after any surgery. I want them to be built up.
Yeah.
So when they fall, they are still in an acceptable place.
Yeah.
Sounds like our 30s.
Yeah.
Yeah, well, you want to build it up so that when you fall, you have more to recover for your recovery. But as well, generally, at that point, it's about the good posture. It's about the good daily activity. It's about the learning about what to do, what not to do. And you spend way more time with the patient than I do by nature of our relationship to the patient. And so it makes me a little jealous that you can spend all that time with them. But on the other side, I know they're in good hands to prepare them for the surgery. So contrary to many surgeons, all my patients get.
Well, it's really important to say, and I recognize this is going to sound self-serving in the company that I'm in, but I can tell the patients that come in from you, and I can tell the patients that come in from other surgeons, when you cut the muscle and you cut the bone, they don't go back. And functionally, after these procedures, it's obvious that they're able to regain their and restore their function and capacity and their muscle and their ability much quicker at a much higher ceiling of potential than people who go in with different techniques. So the surgery is critical, and then we have much more base to work with after the surgery, right?
No, we put just yesterday on a picture of a spinal surgery traditional way versus the old, where the muscle are pristine, scar-free, and after the surgery, they always get physical therapy in the hospital. That's, for me, that's a refresher. That's not to teaching them, because at that point they're on the medication, they're obviously in pain. The real education and so on comes before in your hands, in your office. But in the hospital, they get a refresher, and then we give them a little time for the swelling to go down. That we try to be as little as possible that time. Now, preferably maybe just a week or two. And realistically, it's about 2 to 4 weeks until they can work with you again in a positive way, not just come there and complain and just everything they do is painful and so on. But then I think that is where real good job comes in, where you prevent them to have the next level in the same situation 2 years later. I think that is the most important part for me, that I'm hoping every surgery will be the last surgery for them. And I think 90% of that job is you, only 10% of that
But
job.
I'll tell you, not many surgeons say that sentence, which is
Yeah.
really
Yeah.
quite a gift to hear.
So we are at almost at over with the time. I think I learned a lot today.
Oh, I learned a lot for sure.
And I think if we can sum it up is, if I was a legislator, I would mandate like children have to go to the pediatrician every few months. That's mandated in many places. I think everybody should go to a physical therapist at least once or twice a year. I would truly mandate that because that will save us so much time and money and effort in the long run that like parents say, are you sure you wanted to force that 11-year-old to do 30 or 20 hours of
Right.
something in a week or so? So I think that is, if I can take something from that, be balanced in your life and get on early. Physical therapies are not like surgeon. You should see me as little as possible, but you should see him as often as you can get your hand on him.
And I think another thing that's important to mention is just maintaining activity as you age and trying to be cautious or trying to find other ways to be more active. I have 2 grandmas. I'm really lucky. One of my grandmas is much more, they're about the same age. One of them is much more active than the other. My grandma, who's 1 year older, she uses a walker. She cannot make her own bed. She can undo her bed, but there's a lot of things she can't do. And her whole life, she's been getting dropped off by her husband at the door and just very little walking, a very nice, lax life. Where my other grandma, she's hardcore. She's Hungarian. She's 1 year younger, but she is so active. My whole life, I remember them waking up together at 5 a.m. to take walks. And my grandpa uses a cane now, and my grandma like forces my grandpa to take walks to the mailbox with his cane because she tells him, if you can't walk to the mailbox, you cannot walk anymore.
Mm.
So I think it's important to keep your
High five, grandma. Wow.
This is life.
Yeah.
Gym. This is
yeah,
life
that's
gym.
life gym. Yeah,
That life gym.
we used to get mad at her growing up because she would park in the furthest parking spot she could find because she said that's good for her health.
This is what I tell my patient
Yeah.
who wanted one of those badges to park next to the Walmart and say, you know what?
The
If
handicap.
it's up to me, instead of handicap badge, I would give you a badge that you have to park on the farthest place in Walmart because that small frequent walks is what you need. I love
Yeah,
that.
yeah. It's impressive to see the difference between
Life
the
gym.
2 grandmas. Yeah.
So, Alyssa, what is your last words?
My mind is still trying to wrap around the concept that there may be some more benefits than starting athletics
Yeah.
at age 10. But I actually, the number one thing I learned was the fact that our body age peaks at 30.
Oh, well,
You-
it's not a hard and fast number, but
Well-
it's a
I'd like to think that
Okay, mine is 14 actually. But so
14?
Stick with 30.
I'll stick with 30 and I'll be okay with the average. But yeah, I think I got some work to do.
Yeah.
Sarcopenia. That might have been the word.
That makes
There you
sense.
go.
Sarcopenia.
That definitely makes
So,
sense.
Jeff, your last famous words in
Oh,
this podcast.
Well, what a privilege to be here. I'm just so glad to be working with this wonderful team, and thank you for your trust and for allowing me to meet your patients. And it really means a great deal to me to even be a small part of their stories. So
Well, I have been privileged to work with you. As you see, we have a professional crush on each other. So I admire what he does, and I hope to some degree vice versa.
I think you have a
Very much
professional
so.
crush on Robert Mason too. I saw you posted on LinkedIn, a scholar and a gentleman with
And
like
that's
3
With the heart.
Okay, there are few of us out there. There are few of us out there that they see patient as not another, like
Yes.
revenue stream, or there are
Or
few of us
number.
out there that they see this as a not as a profession, not as a job.
Mhm,
And I
agreed.
think
Yeah.
those people need to.
They deserve the hearts.
They
Send
deserve-
A
them
little extra love.
send hearts.
Well,
Thanks, guys, for
You
watching.
deserve a heart, Jeff.
Hard to see.
Thank you.
Says that, yeah.
Yeah, I'm still
not
giving love.
You always.
So
Thanks,
for-
everyone.
For Essence, this is Dr. Abbasi.
Amanda Armagas.
Alyssa Haber.
And Jeff Winter.